This is the video guidance for Cardiff Critical Care for double pumping a new strength of noradrenaline. This video is in two parts. Part 1, double pumping onto current spare octopus lumen, and Part 2, double pumping onto a new CVC line or a new CVC port. As explained in previous videos, this is how our noradrenaline infusion will be left the majority of the time. The circle part is the clamped line. This is the line that we will be using to double pump. This line does not currently have noradrenaline infusing through it and is the current spare octopus lumen. The current infusion is a 4 mg strength of noradrenaline and is running at 14 mL an hour. Both of our lumens are occupied with 4 mg strength as the old syringe has been left on the octopus but is not infusing. As we are on a high rate of noradrenaline, we need to change our strength to 8 mg. Ideally, we would look to start the 8 mg infusion on a vacant port of the CVC. If we did not have one, we would have to use our current octopus via the lumen that is not infusing. Firstly, we need to remove our old noradrenaline line that is not infusing. We have prepared a new syringe which contains 8 mg of noradrenaline. The syringe and line has been labelled with 8 mg noradrenaline stickers. You will also need to take with you an extra sticker labelled 8 mg to relabel the octopus lumen once you have double pumped through it. When inserting the syringe into the pump, select New Infusion and make sure you do a mandatory set prime. Press and hold the prime button until you can see drops coming out of the end of the infusion. We will connect the 8 mg infusion to the old 4 mg line. This line has old 4 mg noradrenaline in it. Ensure to clean your smart site with a stirrat for 15 seconds prior to connection and leave to dry for 30 seconds. Until we have finished double pumping, we will leave the 4 mg sticker on the octopus lumen to identify there is a different dose still remaining in the lumen. Unclamp the octopus line and follow the line back towards the 8 mg syringe. Ensure that that clamp is off and prepare to set your rate. As we have a single strength infusion running at 14, our double strength infusion will need to be set at a rate of 7 mL an hour to match the strength. Once you have started double pumping, do not leave the patient. As per the SOP, we will monitor our systolic blood pressure for a rise of 10 mm of mercury to confirm the noradrenaline is through the line before we halve the rate of the old single strength infusion. For the purpose of this educational video, this process has been sped up. This can sometimes take up to 10-15 minutes when you are with your patient, dependent on the rate of your infusion. We may find that there is an initial rise in systolic blood pressure which may tail off due to the dead space still containing single strength. Monitor your patient's systolic blood pressure very closely during this time and titrate the rate accordingly. You may find you need to reduce the rate of the single strength infusion slower than by halfway each time. Once you are sure the double strength noradrenaline is all the way through the line and you have weaned the rate right down, you can stop the infusion. Follow the line back to the patient and clamp the line of the octopus. You will also need to ensure that the clamp nearest the syringe is engaged. Make sure you follow the line back to ensure that you are clamping the right syringe. Turn off the pump and leave the 4 mg syringe and line connected to the octopus. This is a safety feature and should also be handed over to the nurse on the shift after you. Before leaving the patient's bed area, we need to change the label that says 4 mg on the octopus where we have started the 8 mg infusion. At the end of this process, you will be left with a double octopus containing 2 different strengths of noradrenaline, which have been clearly labelled and both remaining attached to syringes. When changing the 4 mg line to 8 mg, follow the whole process displayed in this video again. We will now show part 2 of this process, which is double pumping onto a new CVC lumen or new CVC line. In part 1, we showed you how to double pump a new strength of noradrenaline via one of the current lumens of the octopus. The preferred method is to use a new lumen on the CVC. You can also use this video to show you how to double pump a new strength onto a new line. As we are going up a strength, we are changing from 4 mg to 8 mg in our new infusion. We are also changing the line, which will be changed every time we change a noradrenaline syringe, and we have primed, in this case, a new octopus, as this is going on to a new lumen of the CVC. Each of the lumens of the octopus have been labelled with 8 mg. Here we have our single strength infusion running at 14 and our old single strength infusion which is not running and the line is clamped, which we will remove. We will now connect our new 8 mg infusion to the pump. We will select New Infusion and conduct a mandatory set prime until we can see drops coming out of the end of our infusion. Assuming that the new lumen of our CVC has already been aspirated and flushed, we will need to make sure that the line is clamped before removing the smart site. Before connecting our infusion, clean the port for 15 seconds and allow to dry for 30 seconds. Once your new 8 mg infusion is connected, you can unclamp your CVC clamp. The lumen in which the infusion is connected will remain unclamped and the lumen with nothing on it will remain clamped. Follow the line back. Ensure that the clamp nearest the syringe is also unclamped before setting your rate. As we are moving to double strength from single strength and our old rate was 14, we are now going to set the new infusion at 7 mL an hour. Once you have started your double strength, do not move away from your patient and monitor your systolic blood pressure. We look for a rise of 10 mm of mercury before we will start to decrease the old rate, so the single strength, by half. You may find that coming down by halfway on your rate is too much for your patient and you need to come down in smaller increments whilst continuously monitoring the systolic blood pressure. Continue to wean down your infusion until you are able to stop it. Once down as low as 0.1, which is the lowest rate the infusion will go, you can stop your infusion, follow your line back to your patient, and clamp off this line. Ensure that you are clamping off the correct lumen of the CVC. Follow the line back to your patient and ensure the clamp is applied at the syringe end also before turning off the pump. Now that we have double pumped onto a new lumen of the CVC, we will need to aspirate and flush the old lumen of the CVC to get rid of the NORAD in the line and apply a new smart site. If we are unable to aspirate the noradrenaline from this line, we will apply a red bung and label the CVC with a noradrenaline sticker. Please be aware of safety, as one octopus line will be left free. Ensure this is handed over and labelled to avoid boluses and flushes being given via this vacant port.